Top adrenaline rush symptoms, and how to tell them apart from heart failure, created by Life. Adrenaline is the most well-known fight or flight hormone in the human body. We've all heard about it or seen it in the movies, but not everyone fully understands it. The problem is, some people might confuse the adrenaline with heart failure. But, if you learn how to recognize the adrenaline rush symptoms, you will immediately get a hold of the situation. Therefore, we compiled some practical information on adrenaline and how to tell it apart from heart failure. The adrenaline is the body's natural defense mechanism. The stress triggers the release of epinephrine, the hormone responsible for the rush, and transports it through the bloodstream. When the body feels threatened, it starts to send additional oxygen to the lungs and stimulates the brain receptors. The constant release of epinephrine interferes with the central nervous system. It engages the brain to react to the first sign of danger and look for a way out. When that happens, the body's pain receptors go numb, which means people don't feel as much pain as they normally do. The quickened blood flow also boosts stamina temporarily. As a result, people can run or jump much better. The prolonged exposure to the adrenaline hormone sharpens mental focus and clarity and allows people to think faster. Recognizing the adrenaline rush symptoms is the first step to solving the problem. If you know what you are experiencing, you will have a much easier time calming the body. These symptoms include a sudden boost of energy, quickened heart rate, and constant sweating. Some of the other common symptoms are hasty breathing, inability to feel discomfort or pain, a boost in performance, and nervousness. The quickened heart rate makes adrenaline and heart failure a little tricky to tell apart. But, the truth is, these conditions are nothing alike. The only symptom they have in common is the fast heart rate. Everything else is completely different. For example, take the flow of energy. When people experience an adrenaline rush, they immediately feel a surge of energy. While heart failure completely deflates the body of all the energy it has. As a result, people feel weak and exhausted. In many cases, patients notice swelling in the feet and ankles, which makes walking even more difficult. Another telltale difference is alertness. When the adrenaline starts to kick in, our senses become sharper and our minds clearer. The body finds it easy to concentrate and becomes more alert. In this state, the human body will do everything it takes to survive. Meanwhile, heart failure hinders the brain's capacity to remain alert and focused. It reduces alertness and concentration, which makes thinking incredibly taxing. When people experience heart failure, they immediately have the need to rest or wait it out. Adrenaline-caused sudden energy boost can feel uncomfortable. The primary step to controlling the adrenaline is breathing. You need to balance out the supply of oxygen and decrease the possibility of dizziness and fainting. To do that, take a paper bag and try to breathe in it nice and slow. You can also try to find a distraction, such as exercising, which soothes anxiety and distress. Additionally, try to step away from the triggers and go for fresh air. When the body no longer feels threatened, the symptoms will disappear. Knowing what is going on with your heart rate may come in handy as well, to control the adrenaline rush. You can use personal heart health monitoring devices, related apps, and your smartphone, which can help you to evaluate your normal heart rate, abnormalities, and heart rhythm trends. Conclusion: the adrenaline rush is not a major cause for concern. But, if it happens too often, and you are not sure whether or not you might be having heart problems, it's better to contact your doctor. With the right tactics, you will keep your emotional and physical health under wrap. Learn more about how to evaluate your heart health and manage your heart condition at home by visiting upalife.com.